Welcome to the Neighborhood Health Clinic. I am Dr. Robert Tober, Chief Medical Officer, and I'm here today for an educational program of the Neighborhood Health Clinic to teach you about cardiac arrest and what you can do in a medical emergency. If you witness somebody collapsing in cardiac arrest, you would kneel down beside them and check, number one, to see if they were responsive. Are you okay? No response. Number two, are they breathing normally? Note that normal breathing is not an occasional gasp. It is what you would normally consider normal breathing. And number three, go, call 911. If you were by yourself, you would go and call 911 and then return to the patient. If there were other people around, you would yell, help, someone else go call 911, and you would start to do chest compressions. You put the heel of your hand between the breasts. After lacing my fingers together and putting them in the center of the chest, I am going to do 200 compressions at 100 compressions a minute. 1 and 2 and 3 and 4 and 1 and 2 and 3 and 4. You can use the rhythm of the song Staying Alive to sort of give you the cadence of 100 times a minute. This will continue for 2 minutes. At the end of 2 minutes, if someone else is around, they can take over on the other side of the patient and continue the chest compressions until police, fire, and EMS arrive on scene. Another possibility is I didn't witness the patient collapse. I simply found somebody that did not appear to be responsive. What would I do in this situation? The same no, no, go applies here. First, no. Are you responsive? Hey, are you okay? No response. Number two, no. Is the patient breathing normally? No. Number three, in this situation, if I'm by myself, before I go call 911, I am going to start and do 2 minutes of chest compressions at 100 times a minute. If I am alone, I am first going to do 200 compressions over 2 minutes. The reason for that is to move some relatively well-oxygenated blood into the patient's brain. After 2 minutes, I will run, grab a phone, call 911, and then come back to the patient and continue chest compressions. It's very important to continue chest compressions if they can possibly be continued. If you are alone, it is possible that you get exhausted. If you have help, switch out every minute or two so that you continue to deliver the compressions. You will notice that at no time did I tell you to try to do mouth-to-mouth breathing on an adult in cardiac arrest. Adults in cardiac arrest do not need mouth-to-mouth breathing. They need chest compressions. The kinds of people who need mouth-to-mouth are people that have been in a drowning situation, perhaps at the bottom of a pool or in the ocean, or a child. If a child goes into cardiac arrest, it's because they first had a respiratory arrest where they stopped breathing. And in a child, we do have to do both chest compressions and mouth-to-mouth breathing. But we don't need to do mouth-to-mouth breathing in adults in cardiac arrest. A child that goes into cardiac arrest first had a respiratory emergency. A child could fall into a pool and be near drowning. A child could get electrocuted. A child could choke on a piece of a toy or food, or a child could stop breathing in bed, something that we call crib death. The same rules apply. No, no, go. No. Is the child responsive or awakeable? No. Are you okay? 2, is the child breathing normally? No. 3, call 911 and immediately start to do chest compressions, putting your fingers in the center of the baby's chest. I could even use my thumb in a child this small, and once every 5 or 6 seconds, I put my mouth over the baby's mouth and nose and breathe one full breath in and let it out about every 5 to 6 seconds. That way I am both moving blood into the baby's brain and oxygenating the blood by doing mouth-to-mouth resuscitation on the baby. This would continue until first responders arrive, including police, fire, and EMS. These are always very serious calls because children that have stopped breathing urgently need mouth-to-mouth resuscitation and chest compressions, and they must be done relentlessly until help arrives. At the Neighborhood Health Clinic, we have written a manual which you should get. And this manual and this magnet remind you of the things I'm talking about in a cardiac emergency. It is very important that you know and remember that simple mnemonic: no, no, go. No, the patient is not responsive. No, the patient is not breathing normally. Go do something. Call 911, start chest compressions. It's also important that you understand that doing chest compressions before the arrival of police, fire, and EMS doubles or triples the chances that the patient could survive this cardiac arrest. In the United States, 1,000 people a day have cardiac arrest, and about 1 in every 4 of us will actually witness a cardiac arrest in our home, at a restaurant, at a mall, but somewhere. It is also very important that you know not to panic, to step in and do something, and take responsibility for trying to help save that person's life with these very simple maneuvers. Thank you for watching this tonight.